My name is David Fishwick. I work at the University of Sheffield as a reader in respiratory medicine. I'm also here at the Hallamshire Hospital as a consultant respiratory physician. And I also work here at HSL in Buxton as the Chief Medical Officer, helping to prevent workers developing lung disease. I see many people with lung disease each year. And one of my main jobs is to try and work out whether or not the workplace has been important in causing this, and then trying to make these workers better. It is vitally important that workers breathe clean air. Breathing clean air is important. Thousands of workers have been harmed due to previous workplace exposures. HSE estimates that 12,000 workers a year die due to past workplace exposures. It's important to think about potentially harmful inhaled agents in the workplace. It's been in the form of either vapours, dusts, gases, fumes, even mists or fibres. Of course, it's possible to prevent some of these problems in the workplace if everyone, that is workers and employers, take simple, sensible and practical precautions. If you take these sensible precautions, then you can help minimise or even prevent lung disease in today's workforce. That's great news. It's great fun and it's good for you to take part in exercise. It's not just your lungs that it can affect. Breathing in harmful agents in the workplace can affect other parts of your body, including your brain, your kidneys, and even your heart. If you become unwell with breathing problems, you might become more reliant on medication. You might have to see your doctor more often. That, of course, can cause unnecessary suffering, not just for you, but also for your family. Let me tell you about a few patients that I've seen recently in clinic who've developed breathing problems directly as a result of their workplace exposures. I'd like to introduce Phil, who developed asthma directly as a result of his work as a plater welder.
I first noticed it when I just went to bed one night and I woke up and I couldn't breathe. And I'd never experienced that because I'd always played football. I was always fit, and I never smoked in my life. I never experienced not being able to breathe, and it got me down because it's just an awful feeling. You feel as though you're drowning. When it was first diagnosed, when I was actually told, but it was occupational asthma, he did say, finish with welding.
So what were the reasons that made you carry on welding even though you knew it may be harming yourself?
Desperation. I needed a job.
Yeah.
I had 2 young children and a wife.
Yeah. So what do you like now, Phil?
It seems to have gradually got worse as I've got older. And life's difficult, very difficult now.
Could you kick a football around in the park?
No, I couldn't. And I missed all. I could never run around with my 2 daughters in park.
There's a tragedy here, though, because he's now short of breath at rest and finds it very difficult to do things that you and I would take for granted, specifically because of his breathing. I want to talk now about a relatively young gentleman that I saw recently in clinic. He worked for his brother in a local takeaway restaurant, and he was required to use a lot of flour. And one night, very unfortunately, he was admitted to a local hospital with an acute asthma attack. Now, his asthma is well controlled now, he's not exposed to flour, but the tragedy for him is he's now unemployed and seeking work actively with a diagnosis of asthma, and I suspect that places him in a difficult position. I'd like also to talk about a teacher who I met about a year ago. This man was in his 50s and worked at a local college. He was exposed to lots of different substances, but mostly solder fume and wood dust. It was very clear when we got him into hospital and exposed him to wood dust, when his lung function took a major dive and recovered a few hours later, that he was very sensitive to the effects of wood dust. He used this information, I think, wisely. He went back to his employers, who previously hadn't really been that interested in changing the work environment, and he was successfully redeployed into a part of the college that wouldn't expose him to wood dust. This is a real success story. It was identified that there was a problem. He's now working efficiently, he's very happy at work, and his employers haven't lost a senior and very experienced member of staff. I hope you feel that this has been an important and useful message to help you look after the respiratory health and well-being of your workforce. Exposure in the workplace to harmful agents can be prevented by simple precautions at work. Please ensure that control measures in the workplace, such as local extraction ventilation and respirators, are of the correct type. Please also ensure that they are maintained well and that they work efficiently and effectively to provide the worker with maximum protection.